Welcome, DVM3, to your first veterinary clinical pathology practical class. Today we are going to learn how to measure packed cell volume and plasma protein. First, we are going to prepare the blood sample for measurement. First, grab a microhematocrit tube. And grab a blood sample which was collected in a EDTA tube. Make sure to mix the blood well a few times, preferably 12 times. Tilt the blood tube slightly and fill up to 2/3 or 3/4 of the hematocrit tube through capillary action. Careful not to spill the blood. Wipe off the surface of the tube from any blood residue. Seal the dry end of the tube where no blood is present. There are two ways to do this. First is by sealing using a Bunsen burner. Roll the dry end of the tube into the flame until it is sealed. Another method is by sealing using a plasticine. First, cover one end of the tube to make a vacuum. Place the tube onto the plasticine and slide your fingers down and push the tube into the plasticine. Careful not to press down from the top of the tube, as this might break the tube. So these are two ways of how you can seal the microhematocrit tube, either with flame or plasticine. Next, set the microhematocrit centrifuge at 12,000 RPM for 5 minutes. Remove the centrifuge cap. Place the microhematocrit tube in the groove of the centrifuge rotor. It is important to make sure that the seal end is facing outwards. Place the other tube into the rotor and make sure the weight is balanced. Place back the cap and press down until you hear a click. This is important to secure the tubes when the centrifuge is on, or the tubes will break when spinning. Close the lid and press start. Once the centrifuge has stopped, open the centrifuge and remove the cap. Remove the tubes gently from the centrifuge. Now you can appreciate that the RBC, buffy coat, and plasma have been separated. Here's a diagram showing the separated RBC, buffy coat, and plasma. Take note on the content of each layer. Next is to measure the PCV. There are two options that you can use. Option 1 is using a microhematocrit reader. First, identify the scale on the reader, 0 to 100. Place your hematocrit tube on the groove and read the tube on a flat surface. Make sure that the bottom where the RBC begins touches the 0 line. Then slide the perplex plate until the top of plasma is aligned with 100. This means that the total blood is 100%. Then adjust the slider on the left so that the white line is below the buffy coat. Follow the white line and read the scale on the right, which indicates the PCV value. So for this blood sample, the PCV value is 37%. Here's a schematic diagram on how to read the PCV using a microhematocrit reader. Another option to read the PCV value is by using the centrifuge cap. The scale on the cap is also labeled as 0 to 100. First, align the bottom of RBC to 0. Always take note not to begin from the sealed area. Move or rotate the cap until the top of plasma is 100. Then you can read the tube. The PCV value is 37%. Next is to measure the plasma protein. First, you need a glass slide to make a groove on the tube. Make sure the groove is above the buffy coat that is within the plasma, not to include the RBC. Once the groove is deep enough, break the tube at the weak point. Then grab a refractometer, open the lid, and drop plasma as much as possible. Careful not to let the tube touches the prism surface. Close the lid gently as you do not want the plasma to splatter. Then look through the eyepiece while pointing the refractometer towards the light. Make sure to note the SP scale, which is located on the left. This is what you will see. Read the part on the division between blue and the white area. The scale is gram per 100 ml. You need to convert to gram per liter when reporting this value. If you're calibrating the refractometer using distilled water, the line should be on the WG. That's all for this week's practical class, and I'll see you again next week. Thank you.